name is Christiana Alalibuma George. Welcome to Christy's Crash Course. Today we're going to be looking at acute inflammation, but just before we define certain things within acute inflammation, we're going to get to understand the concept of inflammation. Now, inflammation, what does this mean? Simply put that inflammation is the response of vascularized tissues to number 1, infections, number 2, necrotic tissues, and number 3, we have unharmful stimuli like allergens. Example, allergens. Now, what are the 3 or the 4 main definitions that we are going to look at in the concept of inflammation? The first definition we'll be considering is called transudate. The second definition is exudate. The third definition is edema. And the final definition will be host. Stick around. Okay, so what is transudate? Now, transudate is simply the ultrafiltrate of the blood plasma. Now, you have to take note of this blood plasma because we are going to explain it much later. Transudate mostly consists of plasma with little or no proteins, and we have to put that the protein you will find, if you find at all proteins in this transudate, will be albumin. So albumin would be the protein there. Now, transudate has a low specific gravity, and finally, it is a typical situation you see when there is no inflammation. You have to remember this because when we are considering the other subtype, which will be exudate, it will be typical of inflammation. Remember, we just defined the concept of transudate, and we said that transudate is simply the ultrafiltrate of the blood plasma, and it is a typical situation that occurs when there is an increased hydrostatic pressure. So, increased hydrostatic pressure is the most common cause of transudate occurrence. Now, what does this mean? You have your arteries taking up blood from your heart, right? And then they're going to different end organs. And then you have these small arteries, which eventually becomes arterioles, and we get to the capillaries. Now, the capillaries is very interesting because if you zoom out into one of these capillaries, you could simply see that you have endothelium cells surrounding one another, and then covering these endothelium cells, you have things we call pericytes. And because of these permeabilities between them, fluids can easily seep out into the surrounding tissue. Now, that is the concept of your capillaries. And so, what keeps the blood or keeps the fluid within these capillaries will be because of a setting osmotic pressure. Osmotic pressures, these are the pressures due to the proteins within the blood plasma. And what is the pressure that wants to push out fluid from the blood will be our hydrostatic pressure. So in a case where you have an increased hydrostatic pressure, you will have a lot of fluid seeping out into your interstitium where you have your cells and tissues. And that will cause for the situation of transudate occurring there.